listeners and viewers. My name is Trish Murphy with the Orlando Medical News, and I'm joined today with Dr. Feranec with the Radiology Specialist of Florida at Florida Hospital, which is one of the largest diagnostic subspecialized groups in the nation. And today we're going to be talking about cervical health awareness and how we can prevent that. So I'm going to start with a seemingly very basic question, but I think it's important to ask it. What exactly is cervical cancer?
So the cervix is the lower part of the uterus, and what happens is you have abnormal cells there and they grow out of control, and they eventually turn into a cancer.
Okay. Who is at risk for to develop cervical cancer?
So the biggest risk for cervical cancer is if you're infected with a virus called human papillomavirus, or HPV. And you get that virus from unprotected sex, and that's the biggest risk factor for it. Other risk factors would include smoking. Women who smoke have almost a 2-time increased risk of having cervical cancer. If you have immunosuppression, so if your immune system's not working good, like if you have HIV, or if you're on chronic medications like steroids that would depress your immune system, you have an increased risk of cervical cancer as well. And then there's a couple other things. If you're overweight, if you don't eat a lot of fruits and vegetables, or if you have a family history of cervical cancer, all those things can increase your risk.
Oh, very good. Are there any symptoms of cervical cancer that women need to be paying attention to?
Yeah, definitely. So luckily, the early cancer, the precancers, they really don't have any symptoms. And that's why we recommend everyone to get pap smears so that it catches it early. It's not until the tumor becomes bigger and invasive that you actually do get symptoms. And those symptoms are mainly going to be vaginal bleeding. So not your normal cycle, or bleeding after having intercourse, or bleeding after menopause are all signs that maybe something's going wrong. Or if you have a different discharge, that would be another symptom.
So is cervical cancer preventable?
Yeah, that's one of the good things. It's been a huge change over the last 30 years with the onset of the pap smear. It is picking up early cancers so they get treated and they don't progress into the invasive ones. Other things that have came out recently is you can actually get a vaccine now for the HPV virus, and so we recommend that all young women and men get that get that injection at some point. And then obviously not smoking like we talked about before, and those are the main ones.
Great, so leading a healthy lifestyle really helps.
Yeah, definitely.
Awesome. So you're a radiologist, so tell me about the role that you play in diagnosing and treating women with cervical
yeah, definitely.
cancer.
So we usually see the cervical cancer, unfortunately, where it's already progressed. And as radiologists, we interpret PET scans or CAT scans or MRIs. So we use the CAT scans and the PET scans to look for distal spread of disease, like it's going other places. And then we use MRI to locally, it has a little bit better imaging characteristics. We can see the tumor better as a smaller stage, and we can look for just local spread right there. And then recently, in the past couple of years, we've been combining with our radiation oncology colleagues, where they actually will do radiation treatments where they put small catheters into the cervix to treat the cancer, and then they use MRI imaging to make sure it's in the right spot.
Great. So tell me, what makes Radiology Specialist of Florida unique in the imaging of cancers?
Yeah, well, like you said before, we're a very large group, and because of that, we're all subspecialized. And what that means is we do an extra year in training in a specific field. So, for example, I did an extra year in training of imaging of the chest, abdomen, and pelvis, and that's all I do. So, you can think if once you focus on that, you're a lot more interested in it, and you can do a better job. The other thing also is we're training the future radiologists. We have our own residency program at Florida Hospital now. We've graduated 2 classes now, and so we're always up to date on the newest technology, the newest trends in medicine as well. And then finally, at Florida Hospital, uniquely, we do big multidisciplinary tumor boards. So once a week, we'll get together with both the gynecologists and the radiation oncologists and the oncologists and the pathologists, and we'll go over specific patients' plans and their care. We'll go over their imaging, their pathology, so we can come up with a unified treatment plan for that patient.
Thank you, viewers and listeners, and thank you, Dr. Feranec, for joining us. Remember, Radiology Specialist of Florida is with the trusted Florida Hospital brand. They're open 24 hours a day, and they're subspecialized for your care.